My name is Lisa Leilani Ka'anoi, and I'm the engagement specialist for Mauli Ola Malama Lama, which is the Native Hawaiian Healthcare Workforce Development Center at Papa'olalokahi, which is the Native Hawaiian Health Board. And we'd like to welcome you all for joining us this morning, and then also for those that will be joining us later via the recording. So if this is your first time joining us, just like I said, it is being recorded, and we will share it with everyone that registered, including those that registered and were not able to join us for the live presentation. You may use the Q&A feature or the chat feature for any questions, comments, or feedback. And if this is your first time, you will be automatically added to our email list for future presentations. They are on the 2nd and 4th Fridays of the month, unless it falls on a holiday, then we just don't have one that day. And at the end, there will be an evaluation that pops up. And if you have time, it's a Friday. If you have time, that's where we get ideas for future topics. But if you have to run, we will follow up on Monday with another email, just in case you might have wanted to send us any notes or feedback. But I will introduce our guest speakers. So the first one we have with us is Habiba Lomax. She serves as a section chief in the Division of National Health Service Corps. Habiba has been with the Department of the National Health Service Corps for 11 years and is a committed advocate for the underserved. Habiba works closely with the loan repayment programs within HRSA, otherwise known as Health Resources and Services Administration, which she's also dedicated to connecting primary care providers with the communities that need them the most. And her most favorite dessert is strawberry shortcake. Now, our second guest is Tina Simmons. She is a public health analyst with the Nurse Corps Loan Repayment Program since 2018. She obtained her Bachelor's of Health Science at the George Washington University and Master's in Public Health at the University of Maryland, College Park. And her favorite indulgence is anything dark chocolate. So I will go ahead and turn it over to Tina, who will be presenting first.
Hello, everyone. This is Tina. Is everyone able to hear me? Okay, great. So today I'm here to... Okay, hello, everyone.
Here you are.
So today I'm here to present an overview of the Nurse Corps Loan Repayment Program. Next slide, please. Through Nurse Corps, we have helped underserved areas meet their urgent need for nurses since 2002. The Nurse Corps offers programs to help address shortages of nurses across the country. These include loan repayment to nurses who work in facilities experiencing a critical shortage of nurses, loan repayment to nurse faculty, and scholarships to students enrolled in nursing degree programs. But this presentation will focus on the loan repayment program. Next slide, please. Here are some quick facts about the impact of our program. The Nurse Corps program helps alleviate the critical shortage of nurses in high-need areas across the U.S. and its territories. Currently, there are over 2,500 Nurse Corps participants serving at approximately 1,300 sites. Nurse Corps participants provide care to 1.8 million patients annually in urban, rural, and tribal areas. About 31% of our Nurse Corps clinicians work at a community health center or community health center lookalike. Next slide, please. Nurse Corps offers loan repayment to nurses who work in health centers, rural health clinics, hospitals, and other facilities experiencing a critical shortage of nurses, and to nurse faculty who teach full-time at ineligible public or private schools of nursing. Next slide, please. This is a list of the many types of critical shortage facilities that are eligible under the program. In the upcoming application cycle for fiscal year 2023, we will add correctional facilities and detention centers as an eligible site type. Next slide, please. You may be eligible for loan repayment if you meet these 3 requirements. You must be a licensed registered nurse, an advanced practice registered nurse, such as a nurse practitioner, a nurse faculty member with qualified nursing debt. You must have received nursing education from an accredited school of nursing located in a U.S. state or territory. And you must work full-time at an eligible critical shortage facility in a high-need area or an accredited school of nursing. Next slide, please. If awarded, you can pay off up to 85% of your nursing student loans. The program will award 60% of your unpaid nursing student loans in exchange for 2 years of service. If you commit to a 3rd year of service, we will pay off an additional 25% of your nursing student loans based off your original balance. Next slide, please. Half of all loan repayment program awards are set aside for nurse practitioners who are a critical part of the U.S. primary care workforce. Of the 50% allocated for nurse practitioners, up to 20% are available for nurse practitioners practicing in a psychiatric, mental, or behavioral health capacity. These allocations expand the integration of mental health, substance use disorder treatment, and other behavioral health services into primary care across the nation. Also, 40% of the awards are for registered nurses and other advanced practice registered nurses. Up to 50% of those awards goes to those working in disproportionate share hospitals and public hospitals. Up to 25% goes to those working at other critical shortage facilities. And then 10% of the remaining funding is awarded to nurse faculty. In addition, Nurse Corps currently has 2 other set-aside funding categories. We have a women's health set-aside of up to $5 million, advanced practice registered nurses with certifications in women's health. This includes women's health nurse practitioners and certified nurse midwives or certified OBGYN nurses working in OBGYN settings. The other set-aside funding category is for certified public health nurses. Next slide, please. During our last application cycle in fiscal year 2021, program received $112 million, which provided over 1,300 new awards and 349 one-year continuation awards to nurses in exchange for a commitment to serve at either a healthcare facility or a nurse faculty at an accredited school of nursing. So that concludes my overview for the Nurse Corps Loan Repayment Program, and please let me know if you have any questions. Thank you.
Great, mahalo, Tina. Any folks have any questions? And if not, we'll go ahead and we'll move on to the next part of the presentation with Habiba. I'll just get the PowerPoint pulled up here. Let's see. All right, can you folks see that?
No, it's coming up right now, Lisa.
Okay, great. All right, go ahead, Habiba, and just let me know when you want to move to the next slide.
Awesome. Thank you. Thanks again for inviting us here today. As stated, my name is Habiba Lomax. I'm the section chief with the National Health Service Corps. And today I will be giving you a little overview of the National Health Service Corps loan repayment programs. Next slide. The National Health Service Corps has been around for 50 years as of this year. We focus on building healthy communities by supporting qualified healthcare providers. We improve access to these crucial services by practicing in health professional shortage areas. Also, the National Health Service Corps helps clinicians pay off their health professional student debt in exchange for their services in high needed areas. Next slide. Here you can see over the years where we started and where we were headed. And the next slide will kind of show where we are now. When we started out, we started with literally over 181 providers. And now, next slide, please. This is the breakdown that shows where we are. We clearly have grown. 47% of our providers are behavioral health care. 19% are within our nurse practitioners. Next slide. Last year, fiscal year 2021, the National Health Service Corps received over 9,000 applications and we awarded over 8,000. Those awards, all eligible applications were actually awarded last year. Next slide. The National Health Service Corps has nearly 20,000 members serving over 21 million people throughout the United States. Next slide. Now I'll get a little more specific into our programs that the National Health Service Corps provides. Our first program is our 2-year traditional program, which provides up to $50,000 for a 2-year service agreement. Next slide. This program, or our programs, providers receive loan repayment in addition to your competitive salary, again, in exchange for your service. Next slide. The traditional loan repayment program eligibility requirements are you have to be a U.S. citizen, currently work or applying to work at an NHSC approved site, have unpaid government or commercial loans for school tuition, reasonable educational costs, etc., and be licensed to practice in the state where your employer is located. At the bottom here, we'll show you for each program which disciplines are eligible for each program. Next slide. Our next program is our substance use disorder workforce loan repayment program, which is one of our newer programs, focusing on the epidemic with the opioid use. Next slide. This program provides up to $75,000 for a 3-year service commitment. Next slide. And again, the eligibility requirements remain the same. In addition to, you must be working at an NHSC approved substance use disorder treatment facility. And we did add disciplines, new disciplines to this specific program, which is our substance use disorder counselors, our registered nurses, and our pharmacists. And we do give priority to those who have obtained an X waiver, serve in an opioid treatment program, or have a license or certification specifically in the substance use disorder intervention. Next slide. This is our rural community loan repayment program. Next slide. This program provides up to $100,000 for a 3-year service commitment, and you must be licensed to provide such treatment at an NHSC approved rural SUD treatment facility. Next slide. The eligibility requirements remain the same. In addition, we've added an additional discipline, which is our nurse anesthetist. Next slide. The NHSC has partnered with SAMHSA in their medication for opioid use disorder training program. Any one of our providers that takes this program, it's free, can use this to obtain their X waiver and a DEA number so that you will be able to dispense controlled substances. Next slide. Now I'll talk a little bit or give you some information about the support and resources that the NHSC provides. The first one is we have sites throughout the United States that can provide you assistance with locating work if in your area. Next slide. These are our eligible site types, which again are throughout the United States. Next slide. The NHSC substance use disorder treatment facilities are listed here, which are again specific to those programs that are applicable to our substance use disorder. Next slide. Our regional offices, again, provide support throughout the United States. We have 10 regional offices that you can contact to assist you with things that are in your communities that will be how they'll be able to assist you with, again, locating jobs and other resources direct to your state. Next slide. The NHSC also provides a health workforce connector, which this tool can be used to post job vacancies if you are a site POC, as well as a clinician looking for work. Next slide. The Health Workforce Connector, again, is also a job seeker tool for those looking for jobs in your community, and also able to connect you with other clinicians. This piece of the Health Workforce Connector will show POCs, site POCs, how to create a profile so that they can put themselves out there and advertise their sites. Next slide. That will end my presentation today, and now we can, or I'll take any questions that anyone may have.
Great. Mahalo, Habiba. That was a lot of information, and if folks want me to jump back to previous slides, if you have questions, I'd be happy to do that. Looks like, what is the process to become an NHSC approved site?
Yes, there is a process. I'll go ahead. I can post the link to how to become an NHSC approved site here for you. And also, depending upon what region you're located in or what state, you can reach out to the specific region analyst if you need more detail. But I'll go ahead and put the link here to answer your question. Or how would you like me to post it, Tina? Somewhere else or right here to answer this specific question for this specific attendee?
Is that a question for me or for Tina?
Yeah, I'm sorry, Lisa, not Tina. Did I say? I'm sorry, I was looking at her name. But Lisa, did you want me to post it somewhere else or just answer the question for the attendee?
You can do both. You can, if you can put, if there's a link, put it in the chat. Otherwise, you can also answer it live.
Great. And how do you recommend? I'm not sure, how do you recommend promoting these loan repayment programs as a strategy to recruit and retain our healthcare workforce in rural healthcare settings with positions difficult to fill? One way I can connect you with our Division of External Affairs. They are our division who helps us in turn and can also help you with promoting the programs. Of course, the biggest tool is, of course, the monies that you can receive in return for your service. And we do see sometimes that people actually go to a rural area to work just so that they can, you know, get the funding to pay off those high dollar loans. And when you love what you do, sometimes it's just, you know, a no-brainer, I guess.
And then I'm guessing for Hawaii, our regional office would be in California then. Is that correct?
I think it is region 10. I think it is. Let me double check.
I can look on the slides. Let's take a look. So it looks like for Hawaii, the closest region to us is number 9, which is San Francisco.
Okay. Yeah, which is you were correct. California in region 9.
Okay, there are members of our dedicated workforce who are well-trained and have medical licenses that do not qualify for your loan repayment and scholarship programs. How are eligible provider types determined for these programs, and how can this list be expanded to not discriminate against certain licensed provider types dedicated to serving our most vulnerable communities? That's a good question.
Yes, that is a great question. So our program, again, we're dedicated to primary care health. We do understand that there are a lot of medical providers that are definitely well-trained. There are some other HRSA programs that they may qualify for. It's just this specific program does not support all disciplines.
All right, any other questions? Congratulations, by the way, on 50 years. That's amazing.
Thank you.
And of course, those that have registered for the program, both of their slide presentations will be sent out in an email. We are having some delays in getting the recordings out, so hopefully we'll get that fixed soon. All these slides will be sent in the follow-up email with the recording as well. Was there anybody that wanted me to review some of the slides that had a lot of information on it? I'd be happy to do that as well. We have a lot of time. It's only 9:25.
And just to add, Lisa, my my direct info is on the, I believe, one of those slides. So feel free to reach out, email, and I can answer any additional questions that you may want to talk about offline and direct you again to who may be able to best serve and help you with any questions or answers that additionally that you may have.
Great. This is the last slide, right, with all the contact information.
Contact information, yes.
Okay. And then Tina, we have yours too as well. I can put that in the follow-up email to folks.
Yes, please.
Okay. Oh,
And,
you can try to sign up for emails.
and also I want to add that the 1-800 number that was on NHSC's, yes, people can also call to ask questions about Nurse Corps. The same number applies.
Oh, okay. Good to
Mhm.
know. Thank you.